But we've got Pudge and, of course, our resident vet, Miss Brooke West. Nice to see you.
Nice to see
you. Now, today
guys.
we're talking about heartworms. And, of course,
yes.
I think that everybody knows dogs are very susceptible to heartworms, but most of us don't even know where they're even from, how do they get them. So if you kind of give us a little basic explanation.
Yeah.
Oh, sorry,
so heartworm disease comes from mosquitoes, and most people don't understand or realize that. A mosquito will bite an infected dog, and then the larvae will turn into the L3 larvae in the mosquito, and then the mosquito bites another dog. It becomes the intermediate host, and then bites another dog.
Transfers.
About 2 to 2.5 weeks later, that can happen, and it transfers to another dog at that point, and then it takes about 6 to 7 months in the dog to develop into actual heartworms that you see here.
I thought that was a little play toy, and actually it's a heartworm.
Yes, it's a diagram.
Flare, right?
Yes, of how heartworms look when they are infested in a dog. And so, yeah, they're in between the heart and the lungs, the artery that goes in between there.
Now,
they like to stay in that area, but they go and they get into your lung fields, and they create a lot of havoc, such as congestive heart failure and pulmonary embolisms and things like that.
A serious problem.
Yes,
but the good thing about heartworms is that it is 100% preventable.
100% preventable, and that's with heartworm preventatives like we see here, and you know, the cost is dollars to treat and prevent, but to treat, it's thousands of dollars. So it just makes more sense to just prevent and keep these pesky bugs away.
Absolutely.
Yeah.
Now, what about cats?
Cats, it's a different disease. It's very similar, but for whatever reason, they're the atypical hosts. Mosquitoes don't, the larvae don't really go after them, so they kind of have like an inherent immunity to it, and so they get very low worm burdens if they do get infected. They rarely show any clinical signs, and it's really hard to detect because it's not as prevalent in the antigen form that we can detect on blood tests.
All right, Brooke, so much information. Now, where can people go for more information from you?
For more information from us, West Toledo Animal Hospital, Perrysburg Animal Care. We're available during the week and on the weekends for any questions or problems.
Sounds good.